I'm Rob Metcalf. I'm a consultant medical oncologist. I work at the Cystic Hospital in Manchester, and my job is actually quite unique in that my clinical interest is focusing predominantly on patients with salivary gland cancers, and also my job is structured such that I can spend most of my time doing research. So I spend 4 days a week at the moment purely on research, and 1 day a week is spent seeing patients. The main goal of my research is to improve patient outcomes with adenoid cystic carcinoma. So to go about this research, there are different ways. So on the one hand, you can study what you call models of the disease in the laboratory. That means tumour cells that grow in a dish in a laboratory. But actually, to translate those findings to patient benefit, what you really need is to study these disease processes in primary patient tumours. So by primary patient tumours, what I mean is when patients have surgery for their disease, the specimen is stored in the laboratory where their operation takes place. And unless patients give their consent for these tumour samples to be studied, that's where they stay. And so what I do is I offer my patients the opportunity to be involved in this research by donating their tumour sample. That allows me to study all these same biological processes in what you call primary patient material. I currently see patients from across the UK and given the opportunity to be involved in this research and contribute their samples to the biobank, and I'm happy to see patients from across the UK to build on what we've already developed. Patient involvement in the research has been critical to its success so far, and I think will be critical to its ongoing success. So within the UK sort of clinical community, we're very well set up to spread the message about what research is going on. I think people do know, clinicians in the UK do know what's happening in Manchester. I would want to encourage patients, if they're really interested in being involved, I would welcome their involvement in it.